Anthony, what are you doing?
What? Nothing.
You liar, what's behind your back? Anthony, why are you doing drugs?
I'm stressed.
Why didn't you come talk to me about it?
I don't know, you seem stressed. Do you want to?
No, drugs aren't the answer. Did you know that over 150,000 teens go for accidental overdoses?
I didn't.
Yeah, I don't want that to happen to you. I'll go talk to Officer Breen. How often do you catch teenagers with drugs?
I think we've only had 2 so far this year. Last year we probably had about 10.
Okay. How has catching teenagers with drugs changed in the past 5 years?
Well, the difference is the types of drugs that we're catching them with. Marijuana is still fairly prevalent, but we also are starting to see prescription medications.
Alright, what are the consequences for teenagers caught with possession of drugs?
It depends on the type of drugs. Marijuana is a misdemeanor. Depending on the prescription drug, if it's a narcotic type pill, it could be a felony charge. Cocaine, heroin, and any other hard drugs are all felonies.
Have you ever arrested a student for having drugs in school?
Yes.
Have you ever searched someone's locker for the suspicion of drugs?
Yes, and we do sweeps with the canine. The dog comes in and he'll do a regular sniff of the lockers.
Okay.
So we search that person and their belongings.
How many students do you think come into school high in the day?
In this school, maybe 3 or 4.
3 or 4? Would you refer someone on drugs to a rehab center?
If they are a juvenile, they get directed to the Community Center Youth Assistance Program, or they'll go to drug counseling. If they go to the courts, the court orders rehab.
Oh, okay. Thank
If they
you.
don't go to jail.
Alright, thank you very much.
You're welcome.
Did you shout out to Breen?
Yeah, he said that a rehab center is a good choice.
Do you know the good ones?
I think AHMD is down the road.
Well, can you make sure it's a good one first?
Of course. Hello. Hi, I have a few questions. How often do you see teenagers come into the facility for drug use?
We get a lot of calls about it, but not very often do they come in. About 3 calls a week. 5 to 10% of our patients are age 18 to 20.
Okay, and what's the most common drug you see in abuse cases?
Mostly heroin and prescription pills.
How many successful cases do you think you solved?
We have about a 60% success rate.
What is some advice you give to teens?
Listen to your parents. They're trying to help you and keep you away from harm. Being cool is not really that cool.
Alright, that's all. Thank you so much.
You're welcome. Would you like us to send you some information packets?
That'd be great.
Okay. You want to set an appointment at all?
Yes, I want to set up an appointment for my friend up for rehab and drug abuse as soon as possible.
The closest opening we have is Friday. Is that okay?
That's fine. Thank you. Hey, your appointment's all set up.
Thanks, Hannah. Lucky to have a friend like you.
Anytime. Good evening, Anthony. I'm glad to see you.
You too.
Now, why are you here?
I have an addiction to some drugs.
You want to stop?
Yes.
Alright, first off, what kind of drugs are you abusing?
Prescription.
Prescription? Okay, do you know in the U.S. 50 million people abuse prescription drugs?
Now I do.
Today I'm here to clarify your addiction, just ask some basic questions, okay?
Okay.
I'm going to ask you questions of the common effects, alright?
Sounds good?
Alright, have your grades declined?
Yes.
Have you had any suicidal thoughts or any attempts? Have you ever been depressed?
Yes.
Have you noticed any withdrawal from your friends, family, or anything else?
Yes.
Do you notice a change in your personality ever since you started to misuse your drug? A little? How so?
I get less interested in things like I used to.
Okay. Have you ever injected a drug with a needle at all? Good, because if someone else did before you, you could have had a chance to get AIDS or HIV.
I didn't.
Me too. That's all for today.